Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 995th episode. Let's have the headlines of the day. A recent study published in JACC Asia reveals that individuals diagnosed with depression are at huge risk of cardiovascular disease, with women facing a greater likelihood rather than men. Poor sleep can increase a woman's risk of heart disease by 75%, say experts. Study links heavy drinking to increased heart disease risk in young women. Women with heart disease are less often treated with cholesterol lowering drugs than men, according to research. Researchers are recommending an upgrade in a widely used scoring system to ensure better heart disease diagnosis in women. Let's go to the topic of the day. So, today we shall be talking about women and heart disease. And to tell us about this topic, let me introduce our chief guest. The guest who is going to be talking specially about this is Dr. Keshav Murthy CB. Dr. Keshav Murthy CB is an esteemed cardiologist with MBBS, MD, and DNB in cardiology. With these qualifications, he is serving as a consultant at Manipal Hospital, Mysore. His expertise and dedication shine in the field of cardiovascular care. With a focus on patient-centered treatment, Dr. Keshav Murthy's compassionate approach and commitment to excellence ensures the highest standard of cardiological diagnosis, management, and prevention. Patients benefit from his extensive knowledge and experience, trusting his ability to deliver personalized care and optimum outcomes in the challenging realm of heart health. So, today we are going to be taking advantage of his vast knowledge and experience, and we shall talk about women, especially, and heart disease. Welcome, Doctor. Welcome so much.
Thank you very much for the very kind words and introduction. And I'm very happy and express my gratitude to your team for welcoming me to this talk. And I hope the words which we say here would be useful to save a few lives from heart disease.
Yes, definitely, definitely. Thank you so much. And let us go to the various questions. This is a data bank that we have received from patients over the time period, and also from the listeners. And today, as the listeners add in more chats, I will be asking you questions. So, what are the early warning signs of heart disease specific to women?
Yeah, this is a very important topic that we have chosen today, women and heart attacks, the most ignored topic, I would say. And before I answer that question of early warning signs, I would like to put a few facts straight into the minds of the listeners and viewers and readers of this webinar. Women have been neglected from time immemorial, and for the past few decades, cardiologists world over have realized that women have been sidelined in the diagnosis of heart disease, in the application of various treatment, in the recognition of heart disease in women. In fact, in the last decade, only the awareness has come that women or in women also the number one killer is heart disease. It is not cervical cancer, it is not breast cancer, it is not the other things that we think of, it is not even pregnancy related deaths. It is heart disease. The number one killer in the world in women is heart disease, so just believe that. So with that realization, we have started looking into various factors why women are underdiagnosed, undertreated. Even in the available and covered completely by insurance, we see that women, the diagnostic methods are less applied to women. The therapeutic methods, including like you just mentioned, the statin usage in women is less. The colored, even in the white and the colored races, there has been a significant difference and discrimination, I would say, against women. So we should really work on it seriously, see that this issue is addressed, women are treated equally in this field with respect to diagnostic methods. Coming to the early warning signs in women, the disease is same in men and women. Basically, underlying atherosclerotic disease, the risk factors are all same in women. In premenopausal women, there is a relative protection from heart disease, which we all know up to the age of 45 or 50 years. And after that, after a decade of menopause, the incidence of heart disease becomes equal in men and women. This is one factor we should understand. We should never say that women only cause a heart attack. They don't have heart attack. They do have heart disease equal to men once they cross the menopausal age. So we should recognize the risk factors, treat them well, apply the therapies equally for men and women. This bias is commonly seen because in the cardiologist group also about 80% of the cardiologists are men. So when they see a woman with a cardiac complaints, they tend to kind of have a bias that women don't have heart disease. This may be a non-specific symptom like that. But symptom wise, men and women are equal. In women, often the symptoms are not specific because women don't state chest pain as the primary symptom. They may have back pain, they may have shoulder pain, they may have excessive tiredness, fatigue, sweating. All these may be early warning signs in women. If you have classical exertional symptoms, that is, when you walk, you have some chest discomfort or pressing sensation in the chest, shoulder, back, neck, in the upper part of the abdomen. These are important warning signs we should not ignore. Women, what they think frequently, they are involved in the care of the family, they are involved in various other things. They tend to push their symptoms into the background, saying that, okay, let me do this tasks first, then I'll go for a checkup, and then I'll have evaluation and all. Whereas men tend to recognize if they are symptomatic during their work, they tend to get to the hospitals earlier and have a quick evaluation. And off late, we have seen this, and we have started advising when patients come with their spouses to have their spouse also evaluated, which they think is strange advice. Sometimes they look at us twice over, but it is very important advice that we treat them equally, we give them the due amount of respect, especially women who are not expressing their symptoms completely. These are the early warning signs, I would say.
Okay. And once we know these warning signs, what I want to know is the gender specific differences are there till a particular age, but outcome and mortality rates are also different in both the genders, males and females.
Yeah, definitely. This is a very important consideration. Like I said, once the incidence becomes equal after menopause, women tend to do worse than men. In fact, diabetic women, if they develop heart disease, they have smaller coronary arteries, they have poor ventricular function, they have been recognized late. Even after a heart attack, the mean time for a woman to come to hospital and have treatment is longer than the time taken by men. Because of all these factors, the mortality rate in women with heart disease is much higher than men. So we are extremely careful when we have a lady patient with a heart disease.
And what are the potential complications? Like one you said was that the coronary artery is much thinner. Any others in females as such?
Yeah, in women, especially the diabetic women, tend to have more complications, more reduction in heart function when they have a heart attack. Basically, like I mentioned earlier, they're recognized late. So by that time, the disease has taken its toll, and myocardial infarctions are larger, ventricular function is lower, heart failure complications are higher, heart failure mortality is higher in women. So all these complications are significantly higher in women with heart disease.
So, besides, diet and exercise, any other lifestyle factors which are responsible for problem in women?
Yeah, in the younger women, we have seen that diabetes is a very important risk factor in our country. Diabetes is a big epidemic, and women below the age of 40, premenopausal women, if they develop heart disease, diabetes is a very common risk factor. And apart from that, in our country, it would seem strange, but smoking is increasing. Tobacco usage in women is increasing in India, especially in the teenage group, in the college going girls. tobacco seems to be a fashion and tend to is showing an increasing trend as opposed to the other countries. So I would put tobacco consumption and smoking as a very high risk factor. So apart from diet and exercise, we should pay attention to our drugs and smoking, even passive smoking, to diabetes, to early development of vascular disease, to family history. If they have a strong family history of coronary artery disease, we should pay special attention to that. Evaluate these risk factors periodically, just like we do in women. We know that the epidemic of coronary artery disease is about 50% of the heart attacks in India occur below the age of 50 years. So, and about one third of the heart attacks below the age of 40 years. So, the same rule should apply to women too, with respect to preventive health checkups. So, we should go ahead and do that. And apart from diet and exercise, if we find that their cholesterol is high, or they're diabetic, or they're smoking, or they have family history of heart disease, we should apply the same preventive measures with the same intensity that we do in men to reduce the incidence of mortality due to heart disease in women.
Besides all these, does mental health, including stress and depression, add to problems in case of women with heart disease?
Absolutely, absolutely important point. In the younger age group, when we see the profile of heart attack patients, if they do not have the conventional risk factors, when we see a heart patient, we look at their diabetes, hypertension, high cholesterol, smoking, and things like that. If they don't have any of these, stress seems to be a very important risk factor, especially in the new generation, in the younger people. We have seen patients below the age of 40 years, absolutely no risk factors, apparently healthy, but they develop heart attacks. In these patients, stress seems to play a very important factor. And women are also are equally stressed, even though they may not be going much outwardly. They tend to internalize their stress without the expression, and this seems to express as some disease or the other, hypertension or coronary artery disease. So stress is an extremely important factor, difficult to recognize, difficult to diagnose, but once we make a note of it, we should treat it aggressively, many of the times with counseling, lifestyle modification, and few of those patients could be helped with medicines too.
Now, just before menopause, women go through a lot of hormonal fluctuations, just like the estrogen levels go high or low. So, does that also impact the heart health of a woman?
Absolutely. Like the hormonal composition of men and women, we know are slightly different, and especially around menopause, there is a serious fluctuation in the levels of the women hormones, especially estrogen and progesterone, and these seem to have an adverse effect on the vascular health overall, and thereby that is what causes the heart disease incidence to become equal in both men and women. So, especially around menopause, we have to be careful. Menopause per se as an event may not contribute as a risk factor, but the hormonal changes occurring around menopause and some of the symptoms common to heart disease are also common to menopause, like sweating or flushing or some discomfort in the chest or back or neck, or these kind of symptoms may be confused with menopausal symptoms. So we have to be especially careful when a woman becomes symptomatic and evaluate them completely and see a cardiologist, specifically their physician, general practitioner, or a cardiologist where required, and have their symptoms thoroughly evaluated before deciding that it is a menopausal symptom. Don't put everything as a menopausal or a postmenopausal or premenopausal symptom before evaluation. That is a mistake that we commonly do.
In the past history of a woman's life, especially during pregnancy, if she has had high blood pressure or diabetes, does that also add to a high risk factor for her developing heart disease?
Absolutely, absolutely important point. If during we always take a history of pregnancy-induced hypertension and diabetes, if they have impaired fasting glucose or actual diabetes during pregnancy, it puts them at a higher risk of developing true diabetes later on in life, and also puts them at a higher risk of heart disease than patients who do not have impaired glucose tolerance and hypertension. Definitely, if they have a history of hypertension, diabetes, an adverse pregnancy outcome, deep vein thrombosis. We all have ignored this particular problem. About 10% of pregnancy related deaths are due to DVT and pulmonary embolism. So, this is an important thing we have to all recognize and understand. and try to prevent and thereby alleviate the risk of mortality. Definitely, hypertension during pregnancy, diabetes, obesity, any vascular event during pregnancy put them at a higher risk subsequently.
Certain kind of autoimmune conditions are now being diagnosed more, and people are aware, so they go to the doctor very early. So conditions like rheumatoid arthritis and SLE, etc., do they also increase a woman's risk of heart disease?
Absolutely. Non-atherosclerotic coronary artery disease, that means coronary artery disease arising from causes other than atherosclerosis, is a well recognized entity, especially in young and middle aged women. Women tend to have spontaneous coronary artery dissections around pregnancy and childbirth. Apart from that, they have arthritis related problems, either myocardial infarctions or stress cardiomyopathies, and some of these connective tissue disorders make them prone to thrombosis in the coronary arteries, so they tend to develop coronary events related to their vascular problems. In addition, the treatment that is taken for these arthritis, most commonly the steroids and immunosuppression, tend to make them more susceptible to developing abnormal blood sugars, abnormal lipid profiles, which in the long term may adversely affect their vascular health.
Certain conditions, like it's very common to diagnose PCOS in youngsters, young girls, and elderly age group also. So all these women who are suffering from polycystic ovarian disease, are they more prone to heart disease?
Yeah, PCOS or PCOD is a commonly recognized entity, and of late we have seen that it is linked to metabolic syndrome, which is quite common in Indian population, where obesity, impaired fasting glucose, hypertriglyceridemia, and PCOD seems to be a component of the. It has been included in that spectrum. So certainly, these patients have to be careful, pay attention to their waist hip ratios, especially deposition of fat around the abdomen, and try to do regular exercise and diet and maintain ideal body weight and height to waist index, which is now come up as a new risk factor, especially in Indian population. So we have to take additional care for these patients.
Right. Abdominal obesity is a very major problem with Indian women.
Absolutely.
So,
Absolutely.
can certain medications increase or decrease a woman's risk of heart disease, like if they are on hormones or oral contraceptive pills?
Yeah, this is another thing. If patients are on hormonal supplements, their vascular health is adversely affected. Especially oral contraceptive pills are very well known and associated with venous thrombosis and pulmonary embolisms, and make them prone to developing clots in the blood vessels in the circulation, both venous and arterial. So we these are a special group of patients. When they require oral contraception, we have to take care that they do not develop thrombosis. Maybe in some selected instances we need to investigate whether they have underlying risk of higher risk of developing thrombosis by certain blood tests.
So, similarly, if they are taking menopausal hormone therapy, will it affect their risk of heart disease?
There was a lot of interest in hormone replacement therapy about a decade or two ago, about, I would say, about 20 years ago, when I was studying my cardiology, that hormone replacement therapy would kind of favorably influence the risk of heart disease, but it didn't prove to be so.
Be
So
true.
hormone replacement therapy as a preventive strategy for coronary artery disease is a no-no. If they require hormone replacement therapy for some other reasons, then they can go ahead with that, but with additional precautions which apply to all the women.
For the women, are there any additional or specific tests to diagnose that, to detect heart disease, or any special biomarkers which can be used?
The biomarkers and the cardiac diagnostic tests are common to both men and women. Only, like I said, the differences are in the application. If we carefully see in the outpatient department, if a lady, especially a younger age group lady, comes with chest pain, we always tend to dub it as atypical chest pain or non-cardiac chest pain without appropriate investigations. But this should not be done. If the same aged male approaches the OPD, whatever tests are applied to them, like basic tests like ECG, echocardiogram, even simple tests like treadmill testing, is lower in women. For some reason, we are biased towards that. Advising a lipid profile, which is lower in women. If you see the data worldwide, not only in India, even in the US and Europe, which we think of as advanced countries, the application of the same diagnostic test, same diagnostic biomarkers, which are equal to men and women, that should also be equal. Application should be equal and timely for detection of coronary artery disease.
Like we were talking about the metabolic syndrome, are there any latest advancements where treatments can be specially tailored or women, and specifically those women who are having this problem?
I wouldn't specifically say that there are many new advances, but the understanding has certainly improved. We have recognized the various components of the metabolic syndrome better, and the treatments have been the same: intensive lifestyle modification, dietary modification, and where applicable, the usage of drugs, preventive drugs, primary prevention drugs like statins. If they are obese and have a family history of diabetes and have impaired fasting glucose, the usage of metformin seems to help them with the postponing the diabetes. The preventive method should be applied by looking at the criteria and the recommendations in the various guidelines. So the understanding of metabolic syndrome has improved.
That helps a lot. So, because if you can diagnose naturally, you can help treat them also. Can specific dietary patterns help reduce the risk of heart disease in women?
Absolutely. The same dietary patterns that we advise men also apply to women, especially with respect to reduction in saturated fat intake, with respect to intake of pure sugars and carbohydrates. The intake of fat, sugars, and salt should be the same as in men. There are no specific gender differences with respect to diet. We should respect the body mass index. Women are generally smaller in size and tend to develop more abdominal obesity. And the application of lifestyle modification measures, the dietary modification measures should be absolutely the same, and in fact stricter in women, I would say.
So, the adolescent period and the young adulthood period, we do certain, we cross the limits. So, in the lifestyle factors, ignoring the healthy ones. So, does that impact heart disease later in life for women?
A very important question with respect to primary prevention. What we have recently found is that there is a world obesity epidemic. In addition to diabetes epidemic, hypertension, vascular disease, there is an obesity epidemic. Even in our country, which we consider as a developing, or now we can say India is also a developed country, the incidence of obesity in children is about 18 to 20%. There is an alarming increase in obesity in our country, which is underdiagnosed, under-recognized, and we frequently tend to ignore them, saying that children are looking healthy, but it is not. If we see the current epidemic of diabetes, which is coming to close to 1 in 5 Indian is becoming a diabetic, this has happened 20 years ago. Means we have followed lifestyle and diet about 20 years ago when the current adults were children. So we should look very, very seriously at introducing lifestyle and diet measures earlier and earlier. I would say adolescence also is a late period because habits have already got installed in infancy and early childhood. In school going children, we should install the habits of eating less fat, and that craving for sweets and saturated fats and processed foods is installed very early in life. And once it is installed, it's very difficult to modify anybody's diet and habits. So we should act very early, adolescent, pre-adolescent, maybe school children, where we should start applying the healthy measures. In fact, some of the pediatricians have now recognized that problem, and the Indian Association of Pediatrics has come out with guidelines of avoiding sugars and salt for infants even up to the age of 3 years. Don't give them any pure sugars or salt. So if you install these habits, they'll grow up eating, recognizing natural food as the natural taste. So how have we installed that addition of having a sweet or a salty food as the tasty food? So if we install these habits very early, we can prevent the obesity epidemic. And in the next 20 or 25 years, maybe we will see a reduction in diabetes, hypertension, heart disease also. Very, very pertinent and important question.
So we will have a healthier tomorrow then if we start today.
Absolutely.
You're very
Absolutely.
right. So, how can healthcare providers better educate and empower women to advocate for their heart health and also recognize the early warning symptoms?
Again, a very important question. Since in the Indian society, women are the people who cook and provide the food in most of the households. So, if we educate women, we educate the entire family, which is a very important point, that we educate women with respect to the health risks of the cooking habits, especially with respect to addition of saturated fat and salt and pure sugars and calories. And in many of the households, women are the ones who shop for food. So if we install the right habits in women, the entire family will become healthy, because they are the ones who choose which, say for example, which oil to pick up in the market, which kind of biscuits or sweets or chocolates that you pick up for the children. So these are mostly decided by the women. So if you have a educated, health conscious lady at home, the entire family gets healthy. So that is a very, very important point, that we educate this caregivers or the affectionate mothers and affectionate wives to take up the right habits, so that their husbands and the children and the entire family will be healthy. And the early warning signs also, the women should become more and more aware of not only themselves, their family members also. Sometimes others may ignore the symptoms, but if the lady is aware of that, she is the one who picks up the symptoms and brings them to attention quickly. So that is an important point, very important point.
You touched on a very important point, and that is the oil and oil consumption. I think we'll need a separate whole discussion
Of
on that,
course.
what oils to take and how much to take. So we'll let it be for another day. Between you and me, we will have a meeting on this again,
Yeah.
because I'm getting so many questions on it instantly about what oil to use, how much to use, and all that.
Yeah.
So, you have told us a lot of things about women, their lifestyle, and how they ignore themselves. So, in the end, can we have a takeaway message for all these women so that they take better care of themselves?
Absolutely. The takeaway message I would give to women is that become aware of yourself, be educated, be health aware, and always be conscious of what you're doing, what you're cooking, what you're saying to the children, what habits you're giving to them, because you form an important part of the preventive mechanism for heart disease. Not only you should take care of yourself with regular health checkups and whatever advice I've been given. Don't ignore your symptoms. If you have chest pain, say chest pain, loudly shout, I have chest pain. Many women, when they have chest pain, they just keep quiet. Let me finish the household work, I am busy with this, I'll see later. That is why the heart attacks occur and you present late. So first take care of yourself, then only you can take care of your family in a better manner, isn't it? So that is one message I would like to give to the women. Be conscious, be aware of what you speak, what you do, what you cook, what you shop, and by this you can save lives. Many of the times we see that even though they know, they tend to ignore it, they tend to kind of overlook that. So don't do that. Take care of yourself and your family, and have a healthy and happy heart life.
Thank you. Thank you so much, Dr. Keshamurthy, for joining us today. Could you show us the certificate, please?
Oh,
This is
thank
a
you.
very small thank you gesture from our side, although it's not adequate. Our listeners are coming in with so many thank you messages. One girl has written, or lady has written, that watching from USA, rightly said, doctor, I'm very happy. So this ma'am, Ruby ma'am, has really appreciated and summed up in our own thoughts in her words. So thank you so much. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
I am happy and very grateful for this opportunity